I do want to focus on the issue of health care, because Senator Clinton has suggested that the flyer that we put out, the mailing that we put out, was inaccurate. Now, keep in mind that I have consistently said that Senator Clinton's got a good health care plan. I think I have a good health care plan. I think mine is better. But I've said that 95% of our health care plan is similar. I have endured, over the course of this campaign, repeated negative mail from Senator Clinton in Iowa, in Nevada, and other places, suggesting that I want to leave 15 million people out. According to Senator Clinton, that is accurate. I dispute it, and I think it is inaccurate. On the other hand, I don't fault Senator Clinton for wanting to point out what she thinks is an advantage to her plan. The reason she thinks that there are more people covered under her plan than mine is because of a mandate. That is not a mandate for the government to provide coverage to everybody. It is a mandate that every individual purchase health care. And the mailing that we put out accurately indicates that the main difference between Senator Clinton's plan and mine is the fact that she would force, in some fashion, individuals to purchase health care. If it was not affordable, she would still presumably force them to have it, unless there is a hardship exemption, as they've done in Massachusetts, which leaves 20% of the uninsured out. And if that's the case, then, in fact, her claim that she covers everybody is not accurate. Now, Senator Clinton has not indicated how she would enforce this mandate. She hasn't indicated what level of subsidy she would provide to assure that it was, in fact, affordable. And so it is entirely legitimate for us to point out these differences. But now, I have no objection to Senator Clinton thinking that her approach is superior. But the fact of the matter is that if, as we've heard tonight, we still don't know how Senator Clinton intends to enforce a mandate, and if we don't know the level of subsidies that she's going to provide, then you can have a situation, which we're seeing right now in the state of Massachusetts, where people are being fined for not having purchased health care, but choose to accept the fine because they still can't afford it, even with the subsidies. And they are then worse off. They then have no health care and are paying a fine above and beyond that. That is a genuine difference between myself and Senator Clinton. And the last point I would make is the insurance companies actually are happy to have a mandate. The insurance companies don't mind making sure that everybody has to purchase their product. That's not something they're objecting to. The question is, are we going to make sure that it is affordable for everybody? And that's my goal when I'm President of the United States.
Senator, as you two...
I do provide a mandate for children because, number one, we have created a number of programs in which we can have greater assurance that those children will be covered at an affordable price. On the point of many adults, we don't want to put in a situation in which on the front end we are mandating them, we are forcing them to purchase insurance, and if the subsidies are inadequate, the burden is on them and they will be penalized. And that is what Senator Clinton's plan does.